You are listening to the Cultural Providers Network podcast, a Minnesota Association for Children's Mental Health production, building and sustaining a network of culturally and ethnically diverse voices to promote policies, practices, standards, and research that improve the mental health of children, their families, and communities.
This podcast is brought to you by the Minnesota Department of Health. Greetings, everyone. Welcome to the Cultural Providers Network podcast. I'm your host, Brandon Jones. And on today's podcast, we have a phenomenal clinician here in the state of Minnesota, in the Twin Cities, I was going to say, but here in the state of Minnesota, Jimmy Heggs. How you doing, Jimmy?
I'm doing real good. Thanks for having me.
Absolutely. Thank you for being here. Now, the first question we ask folks is just for you to tell us your origin story. Who are you? Where you come from? How did you get into this field, etc.? So who's Jimmy?
Well, a lot of times I even say this to clients. Jimmy Higgs, is a kid from Lambert, Mississippi, a town that had one red light. And Lambert, Mississippi is located in the Mississippi Delta. So, just like the book, I came of age in Mississippi. I mean, I'm a real country guy, bone to bone. And of course, it was a shock coming here to Minnesota, but that's who I culturally am. I'm still that kid from Lambert, Mississippi, showing up in the inner city of the Twin City areas.
Perfect. And what got you into this field of mental health? How did you get into working with folks and helping them through some of their, toughest times in life?
Yeah, I mean, it's funny you say that because I was just saying something to somebody the other day when they asked me a similar question. And sometimes you got to hear what you say to know what you're thinking, right? So I was thinking, I kind of had a resume as a child. I noticed, it really boiled down to the response of my environment. I remember thinking at an early age, people should do life a little bit more chill, a little bit more calm, or a little bit more humanizing than what my earlier experiences reflected to me. So a lot of who I am was a response to my environment and of the lot of the values I hold, like as a therapist. I mean, those are my values back in the day. Just wanted to chill, just wanted to have a conversation, just wanted to get some understanding and move forward in an amicable and loving way. And so that's in my DNA. Now, getting a degree and licenses and all of those are the cherry on top. But I don't know. I know it's cliche to say. In that way, I was born a therapist, and my environment genetically modified me to be the person who I am today.
Absolutely, man. I can relate to that. I've always kind of been a helper, and a connector. And, I actually stumbled into therapy myself. I originally went to school to be a dentist. I was at the University of Minnesota. I was struggling though. I was taking pre-dentistry classes. I was just happy to be on campus. I didn't know what I was doing, man. I almost flunked out. And I remember I was having a conversation with my best friend. He was my roommate at the time. And something interesting happened to me. I had three young women who two we were friends with, one young woman I was dating, and they had all disclosed to me like within like a short amount of time, like maybe like a month or two, that they had been sexually assaulted. And
Hmm.
I was just like, when the third young woman had told me that, I'm just like, why do these girls keep telling me about this
Right,
traumatic
right,
experience? Like, what is this about? And I'm talking to my roommate. I'm like, man, what's wrong with these girls? Like, what's going on here? And
right,
for me, I knew what it was. Obviously, we talk about it on college campuses, but I'd never known anyone who's actually shared that type of information.
hmm,
So he was just like, well, Brandon, man, like people like when you talk to them, like people you listen and you usually give some decent advice. Like you should think about becoming a
hmm,
therapist. Light bulb right there. I was just like, you
hmm.
know what? Maybe I should. Maybe I should do that. And then
Yep, that's right.
when I started to rethink my major, I was taking a sociology class, and I realized a lot of that made a lot of sense to me, just human behaviors, understanding race, class, gender, all those things. So it was kind of like my natural kind of personality blended in with the education, and then I just kind of fell right into it after that.
Hmm.
So it happens. But another interesting thing, being black male therapists, like we
Mm-hmm.
are pretty much like being unicorns. Like there's
Mm-hmm.
barely us out here. So we have
Yeah,
this unique kind of factor to ourselves
that's right.
as well. And I don't practice clinically anymore. And I feel guilty because there's not enough of us and there's not a lot of us. And taking myself out of that space, but I realized that space wasn't a healthy space for myself because
That's
I was
right.
I was
I
I
heard
was
you.
moving at a pace that was way too fast. I had my cape on way too tight. I was trying to save the world and the
There you
community and
go.
everybody. And I was like, if I
Mm-hmm.
keep moving at this pace, man, I'm gonna hate mental health. I'm gonna hate therapy.
Yeah.
Go back to this. So I can relate a little bit to your experience for sure, man. Yeah.
Mm-hmm.
Yeah. So I'm gonna ask a question on that. I'm gonna shift to the cultural piece
Yeah,
around
yeah.
the awareness because one thing we do here, whether it's in mental health, sometimes even in education, is representation matters. And being a black male therapist, how does that show up for you in these therapeutic settings and dynamics? How does that show up for you culturally?
Well, it's interesting, most of the time, by the time someone contact me or sought out a black male therapist, they're a little nervous. And I know that they are because I've been there before. So let me see. So I think one of the questions I have when we first meet, I usually tell them a little about myself. Like I don't shy away from calling myself, that kid from Lambert, Mississippi, because from my experience and what I know in the literature, you got to know how to read between the lines, which I'll get to about high context. Um, People of color want to know a little bit about you before they start telling you all their business. So I really want to start right out the gate by giving them a story or two. That's not, not oversharing, not particularly undersharing. It's something with some teeth to it. You heard me say response to my environment. You heard me say I wish people would just kind of chill and kind of humanize each other. You can kind of abstract from that a little bit what I'm talking about. So right out the bat, I like to start to give them information like that. And so that they'll know that, this ain't just me prodding and pricking at them and sitting in a place of hierarchy or higher than thou, but I'm really here to have a conversation.
Absolutely, absolutely. Do you mind sharing a little bit more about you said high context, and kind of like self-disclosure and how that helps to connect with clients, especially clients of color, I'm assuming. Can you share more
Yeah.
about that and that experience?
Yeah. So well, I'll use myself as an example. I grew up in the Mississippi Delta, and a lot of things, a lot of information we get, we don't necessarily get it all from what you're saying exactly, but we get it from how you're saying what you're saying. We get it from inference. We get it from overtures. For example, if I came over to your house and we were sitting down eating, and I said, man, I gotta get to this airport, and the car broke down, and this is gonna be hard. And I gotta make this flight because they don't let you just rush on the airplane. And hadn't quite figured that out yet. So the high context will be an opportunity for you to decide, oh, sounds like Jimmy needs a ride to the airport. And one of the reasons he's here talking to me is to ask me for a ride or to see if I'm open and willing without a commitment to give him a ride to the airport. So then you might say, oh, do you mind if I give you a ride? And I might go, huh, if you got the time. So that's what a conversation might look like. Um, in my practice, oftentimes people are a little nervous and they feel intimidated and self-conscious. So they might start talking, they might say a few words to say, you know what I'm saying? I just feel frustrated because my partner, you know what I'm saying, and my job, you know what I'm saying? And a lot of times I'll accept a lot of the you know what I'm saying for a while and see what I can abstract. And when we get a little bit farther down the road, you see I'm using analogies. I'll say, hey, I don't want to mislead you. Let's park right here for a minute, and I'm using analogies. Talk about I believe I know what you're saying, but it ain't my job to assume. If you had to flesh out what you're saying, What might you say? And then we'll start to unpack. So right away, I acknowledge and name high context culture. I appreciate it and draw some abstractions. And when we need to drill down a little bit more, I let them know that, my job ain't particularly to um, assume anything. Is to really get curious. And right now, I feel curious. So high context is everything you say without the actual words you're saying it, and the opportunity to give inferences based on nonverbal and paraverbal communication. In some cultures, they're like, you know, we're going to meet at this time. Here's the goals and objectives. We need to be done with priority number 3 in the first 15 minutes, priority number 5 in the next 15 minutes, and we're going to close and we're going to move on to something else. And here are the intentions, and here's the SMART goal that's driving this. So in our next 4 meeting, we would have achieved this outcome. And I'm like, oof, man, sound like a lot of words to me, you know what I mean? So that's what I mean. That's to be a low context. Um, you're not drawing from a lot of context. You're drawing from precise information that they're given that's step by step. In my culture, it can come off as condescending. So I understand that I do have a culture and that that's how people from different cultures prefer to be communicated with. But going back to what I know about African American culture and what I infer or abstract from the literature, they need some wiggle room there to meet them where they are.
Wow, yeah, that was very profound. Thanks for sharing that. I think that's a key piece of just like cultural intelligence is what I would call it, that a
Mhm,
lot of clinicians can take with them and not just think of African American clients, but all clients from various different backgrounds.
mhm,
What is that communication piece and what is that perspective piece that folks are taking in when they are trying to communicate things and one making sure that you're interpreting things in a healthy way for them as well. So yeah, that was
mhm,
that was key right there. Which brings me to my next question about like intersectionality, which is a term we hear a lot in our field. But I don't think we always associate it in a way of how our clients are communicating or connecting with us, like how they're again their perspectives, how they're viewing things. How does intersectionality show up, in your therapeutic spaces that you work through, whether you're talking about um, um, gender expressions or sexual orientation, even class?
mhm.
It's something that we often don't think about is like how class plays a role in how people approach therapy or even process information in our field. How does intersectionality show up for you therapeutically with some of the people you work with?
Well, it shows up in a variety of ways. Number one is of the utmost importance to me, and I really stay in the literature. When I say in the literature, past the research in and of itself, I like to consume literature written by uh, female authors of color because they're neither white nor male. So it really gives me a different perspective outside of my own being a male about what I have to worry about and what I absolutely don't have to worry about. And from that literature, I get a chance to glean their stories, their lived experience, what they know to be shared experiences beyond. Like I can connect with being a person of color. I can't always connect with being a woman, or I can't connect particularly with struggling with identifying with the gender in which I was born. I'm growing into the fluidity of gender and affirming people they want to in a way that they want to be affirmed in terms of using their correct pronouns and being and showing up in curiosity and not with assumptions. Number two, I'm actually married to a Black woman therapist. So we talk about intersectionality as a part of our dinner conversation. It's a part of our night conversation. We watch a show and we go, man, you see that microaggression there? And sometimes we watch a show and she say, hey, do you see how that man came in and mansplained this thing? And I go, oh, I missed it. Or sometimes I might say, being all honesty, I don't think that's what's happening. So every now and then, my wife will say, Jimmy, when we're identifying racism, you're on board. Sometimes I want to challenge you, and I want to challenge you that when I bring up gender issues, you do what white people do. You push back. You say, well, give me more evidence. Well, are you sure that's what's taking place? You say the fundamental things, and then now we get a chance to grow and I get a chance to broaden my lens. The last thing I would say, Black men of color typically reach out to me for therapy, especially when I was seeing a lot of clients. And what one of the things that I assess is, the degree to which they want me to collude with some of their internalized sexism, misogyny, or patriarchy. And I guess underneath um, them seeking me out, it's just sitting in the curiosity. And I know they want to share experience. I know they want somebody who look like them. I know they want somebody who maybe share their heteronormative experience as a man of color. Also, I want to know how much of the things that they don't have to think about, worry about in terms of intersectionality that they want me to conclude with or validate because they hadn't addressed it. Whether it's how they treat their mom, women, all women are, or you always gotta, always and nevers. And I'm really keying in on that. So I think about my invitation to colluding with men in terms of patriarchy, sexism, misogyny, my consumption of literature in intersectionality, and my own personal experience just being my wife who winds up being a clinical consultant about intersectionality.
Yeah, man. Thank you for that. That was really good. Another question I wanted to ask you about was around the role that clinicians play, and your wife may be a consultant in this space too, with the addressing a lot of the systematic issues. Sounds like she challenges you, so I'm assuming she may challenge other folks in the space, and you
Mhm,
probably do the same thing when we're
mhm.
looking at systemic issues of discrimination, racism, even intergenerational trauma as something to think about. What do you think the role is of a mental health provider in addressing those issues for the broader community?
I mean, number one, the role is to sit alongside, Brandon, if it was me and you, and I like to use a lot of analogies as well as feeling words. I just want to sit alongside and have you to start to paint a picture of your lived experience and not particularly challenge anything. Name that you feel minimized, name the ideas you had about if I can only go to college, if I could do all the things right, and your disappointment that your blackness seems to impact that. Name all the ways and you feel a death by a thousand cuts and that you're sick and tired of it. Name all the ways in which you feel like you're on the brink of telling your boss something that's probably going to end the relationship with the job. And then ultimately, really sitting with and getting to an appropriate time. Where do you find your power? In what ways are you capable of change? In what ways were the exception you used it, there was an exception to how you handled or handled something, and really watering that, really highlighting those your your brilliance and your power in nurturing it. The things, the all the systematic pressures that you experience and all the things you've told yourself to get to where you are, what things are still healthy? What things are still useful? What things are used to be useful and now they're not? What things are used to be healthy and now they're not? And really getting precise on what you need to do to affirm yourself and ultimately start to move forward in your power and with the skills that you have in order to be holistic. So what I mean by that is really uh, asking yourself a question: What's coming up for you in your thoughts and feelings? Where are you feeling it at? What can you do about it? What kind of centering exercise can you do? And more practically speaking, where can you go to start looking at resources? Because we're talking about hunger pains, we're talking about lack of money, we're talking about the need to pay bills and not necessarily having access to resources to alleviate those stressors and pressures. So it's both external and internal.
Absolutely, absolutely. Can you share some strategies or techniques that you find effective in supporting BIPOC clients on their healing journeys and empowering them to advocate for their own mental health needs?
Hmm. Man, I would start to ask questions like, where have I heard people talk about mental health before? What words do we use in the community to talk about mental health? I grew up, I'm not particularly religious, but I most certainly grew up in a Christian environment. And they're always praying to wake up in their right mind. What does that mean? And if I had to tease that apart, um, in what ways in which they're talking about mental health, when Sister Johnson had a nervous breakdown, what does nervous breakdown mean? When I feel down and out and I need to pray because the devil is telling me things. Let's unpack that a little bit. So really thinking about the ways in which you're already attending to your mental health and the ways in which you've heard mental health described in your community that may not be clinical terms, and exploring the coping mechanisms you've used to deal with it, the both the healthy ones, the unhealthy ones, and the unorthodox ones.
Thanks. Absolutely, man. Thank you. Thank you. Um, Now we often hear about stigma in the community,
Hmm.
stigma towards mental health. I think that during the pandemic kind of pushed the mental health world ahead a few years, and
Hmm.
it did the thing that I think we wanted years ago, which was we wanted people to come to therapy. We wanted to invite folks in, let them know this is a safe place to get your healing on. And then all of a sudden the pandemic happens and people realize, oh, I need to work on some things. I need to
Hmm.
talk to someone.
That's right.
And we got bombarded with folks. I don't think we were ready because
No.
guess what? What did we realize? Oh, we need to deal with our stuff too. So
Yep, that's right.
we had kind of a double-edged situation happen there. And with this, I think this heightened awareness, what the internet has provided around mental health, I think the advocacy in the space, it has led to us being in a very unique dynamic around people being more willing and accepting of therapy or psychology or just mental health in general.
Hmm.
But there is still some hesitancy out there for folks who are seeking out the professional help. What advice would you offer to BIPOC individuals who may be hesitant to seek therapy or even face barriers to mental health supports?
Um, one of the things that I would encourage, my fellow people to do is just really to have the courage to say that in their first session. Really lay out what they need and what their fears are. You show up to therapy, and before they start asking you questions, kind of rehearse before you get there and tell them exactly what you just said, Brandon. Look, I don't want to go to therapy. Where I'm from, that means something wrong with you. What I'm nervous about is this journey, and I don't know if you're going to understand me because we don't share the same culture. So I want to just name that up front before we get started. And I want you to consider that information as we move forward. And I want an opportunity to just kind of see how I feel. So, um, so I'll know if this is a feels like a right fit for me or not. Front loading information, giving them some stuff to chew on, and letting them know where you stand and what your concerns are. It's a vulnerable thing to do, but that'll be what I would suggest. Just walking right in and kind of having that thing rehearsed. Just let's see how they react to it.
Absolutely, absolutely. I think that definitely would be helpful for a lot of people. That first session I know is a huge, I would say, barrier for a lot of people. People get into that space where they have to explain what has happened, or they have to relive things, or explain again because they've been, down this road at one point or time or another. I know that can be a challenge for so many people.
Hmm.
Let's talk a little bit about the field. I have an interesting question for you around the field.
Hmm.
Um, what changes or improvements would you like to see in the mental health field to better support BIPOC individuals both clients and mental health professionals. So if you could think about both of those two kind of groups, what shifts or changes do you think would be needed to support the folks we help and the folks who do the helping?
Hmm. So to support the people that we help, I think that there's a opportunity to have more resources for clinicians of color to put on workshops for people of color. More workshops in general, resources to have small focus groups who's, got a similar concern about a particular issue, and then more resources to provide financial support for therapists who get paid maybe an hourly rate so they don't have to interact with the insurance company, and to have that to be of no charge to people of color. When I first went to college, my degree was in school counseling, and then I tacked on clinical counseling. And they told us the first thing you want to do is do something for everybody, and then you want to do something for a stratified group with particular concerns, and then when you drill down to individuals, you want to give them resources that they need so they can get something better. So I think the same thing in terms of scalability. I would like, the legislature, the legislators who give money for things like mental health to really start to be unapologetic, to come to people like me and you, or organizations like MACPA, and with resources that help us to remove barriers and provide information to the community, small groups. For example, I was just at the NAACP gala on Saturday night, a magnificent event. And I know that one of the things they talk about is, hey, Jimmy Wink, you think you'll be able to run some groups? We really need this X, Y, and Z in the community. And the bigger thing I was thinking about is, hmm, man, I really wish that there wasn't a lot of barriers so I can do more of that so the impact is bigger. And yeah, the last one would be being able to have state funded resources for out of pocket payers. Now, what do we need for ourselves as clinicians? Time and space to to consult and connect with each other. Um, uh, a space that brings us in community, not only clinical supervision, but also clinical supervision. Not only just being in relationship with each other, but also being in relationship with each other. Not only networking, but also networking, just really having community. I for those reasons, both of those areas outside of community, for the community and for us, I like restorative practices. That's what I've been spending a lot of time doing. That's what I'm gonna try and do at the annual conference this year. I really want people to go back to the origins. People always came together in community. They healed in community. They came to eat. They came to dance. They came to celebrate rites of passages. They came to say, how are we going to take care of the elders? How are we going to take care of young people? How are we going to take care of one another? How are we going to take care of ourselves? So getting back to something that some people call group therapy, but really healing in community is a way in which I think that people of color can feel more comfortable doing something that you don't have to package up and have it be controlled by managed healthcare.
Awesome. Yeah, thank you for that. That was really good. And honestly, it's aligning with a lot of the podcast episodes that I think we're really uh merging and kind of verging, I should say. We're like leading towards something that a lot of providers are feeling like we need, which is this space for us not only to be with one another, but also to say, hey, where are we going? Like, where are we headed with this? And how are we going to do this collectively and maintain ourselves, sustain ourselves in this field?
That's right.
Um, is so we're gonna close on the last question here. Is there anything else that you would like to share with the audience, either about your journey as a mental health provider or your perspective on the importance of cultural competence, intelligence, or responsiveness in the field of mental health therapy?
hmm Repeat the question one more time. I want to make
Yeah.
sure I can grapple with it.
Yeah. Any last thoughts that you would like to share with the audience, either about your journey or about the importance of being culturally, responsive, uh, my term
hmm
intelligent, or competent in the field of therapy? So, any last words around either those two things?
Well, I just want to, for the Twin City area, I want to challenge the new budding therapists. Some people of color, but some are white body individuals to think of it in terms of a growth mindset and culture, uh, humility. You know, there's things that you gonna know. There's things that you're gonna know that you don't know, and not think of that as the whole of it all. Really think about things that you don't know that you don't know, and really think about it as a pursuit. Um, sit with, and this can be what I'm about to say can be overstated. Sit with the discomfort of just not knowing and being okay with that, and being having the courage to take a risk and apologizing when you don't meet the mark because you want to just strive on behalf of people of color. And there's a calculated risk, and there's an opportunity to just lean in and just do what I do in terms of, you heard me say, I sit with the literature of intersectionality. I practice all the time. I got a book that's playing in my audio cast on my way to work and back. So really leaning into the humility it takes in order to call this putting the importance on the journey and not even thinking about a destination along the way.
I like that. I like that. So if anyone wants to reach out to you, ask you questions, pick your brain, consult, set up an appointment, anything, is there anywhere that they should go to get connected to you?
Yep, right now, I'm using my LinkedIn for the most part. That's my primary way of getting connected these days. And as you heard me say earlier, I think I share with the same experience with you. I'm starting to phase away from individual, like in a major way, and I'm starting to do more things that's consulting related. So that's where my mind is at because I want to kind of spread the impact with a larger number of people as opposed to singular individuals, which is fine. And I always have at least a client or two, but reach out to me on LinkedIn. I'm really into doing things that intersects diversity, equity, inclusion with trauma-informed practices in mental health and crisis response too.
Absolutely. Man, it was a pleasure talking to you today, Jimmy. You're a treasure. You are important in this field. Whether you are seeing individuals or doing some larger systematic work, we need you. And if there's any way that I can support you in that work, just let me know, man. I got your back for sure. So
All right, Brandon, I got to say the same about you, man. I
yeah,
follow you on LinkedIn and I read your articles. You are
good.
a lion out here, and it inspires me. I mean, I'm serious. You got to take these flowers, brother.
I'll
It
take them.
it inspires me to see the work that you do, and it makes me want to go out and be right there alongside of you doing the work. Thank you so much for having me, and I'll come back anytime you invite me.
Awesome, man. Thank you.
hmm Have a good one.
You too.